Bismillahirrahmanirrahim. Assalamu alaikum. Do you know that over 300,000 babies are born with thalassemia every year? And many of these cases could have been prevented with simple tests. What if a single blood test before marriage could save your future child from a lifelong struggle? Imagine being 5 years old and needing blood transfusions every few weeks just to stay alive. For millions of people with thalassemia, this is their reality. As a healthcare professional, I have seen how this condition impacts lives and how awareness and prevention can change the story entirely. In today's vlog, we shall talk about what thalassemia is, its symptoms, how it is inherited, and most importantly, how you can help prevent it. I would like to share with you 3 case histories of thalassemia to highlight the challenges, consequences, and preventable nature of thalassemia. The first case history, I label it as the little fighter, Aisha's journey with beta thalassemia major. Aisha was diagnosed with beta thalassemia major at just 8 months old. Her parents noticed she was pale, tired, and had a swollen belly. Soon they learned she would need blood transfusions every 3 weeks for the rest of her life. While Aisha remains brave, her condition has placed a very emotional and financial burden on her family. Aisha's case history highlights the importance of early diagnosis and regular blood transfusions for survival. Remember, children like Aisha rely on blood transfusions to live. Regular donors are true lifesavers. The second case history, and I label it as the heartbreaking discovery, a couple's story. Meera and Raja were excited to start a family. But during pregnancy, a routine test revealed they were both carriers of the thalassemia gene. Their baby was at a 25% risk of having thalassemia major. They had no idea They could have tested for this before marriage. Now they face tough decisions they never expected. Meera and Raja case history highlights that genetics are the main cause of thalassemia and that how marital and prenatal testing can help prevent such situations. Remember, thalassemia is preventable. A simple blood test before starting a family can save a lifetime of pain. The third case history, and I label it as the unsung heroes, blood donors to save lives. Babar, a 28 years old professional, donates blood every 3 months. One day, he met a 10-year-old boy, Ayan, who receives regular blood transfusions because of thalassemia measure from the same blood center to which Babar used to donate his blood. Babar realized his small act was literally keeping Ayan alive. This case history shows that how critical blood donations are for individuals with thalassemia. Remember, every blood donor is a hero. Your small act of kindness can give someone a second chance at life. Let's discuss the important aspects of thalassemia and learning sequence. Thalassemia is a genetic disorder affecting hemoglobin production, leading to anemia and other complications. There are 4 types of thalassemia, and these are alpha thalassemia, beta thalassemia, delta thalassemia, and gamma thalassemia. And a child can have any one of these. What are the causes and risk factors for thalassemia? These include genetic mutations, family history of thalassemia, cousin marriages, and ethnicity, by which I mean that Mediterranean, Middle Eastern, and South Asian, they are more prone to be thalassemic as compared to the others. So if a child has family history of thalassemia, or if there's a family history of thalassemia, or there are cousin marriages where the mother and father they are thalassemic, or one of these are thalassemic, then the chances of newborn developing with thalassemia is high. What are the symptoms of thalassemia? A child with thalassemia is anemic, there is low hemoglobin, the child feels fatigue, the skin is pale, the child becomes short of breath, and on examination there is enlarged spleen. We may find bone deformities, and such infant and child, he or she has delayed growth and developmental milestone. If we suspect someone to be thalassemic, how we can diagnose? For the diagnosis, the common diagnosis, these are the blood tests where we do the complete blood count, hemoglobin, and hemoglobin electrophoresis. Then, of course, if we suspect that the infant or the newborn will be at the risk of thalassemic, then we do the genetic testing as well as prenatal testing. And when one child is born with thalassemia, it is advisable that the whole family is tested for any mutations. Well, how the thalassemia child is treated? The treatment has many components, and these include regular blood transfusions, iron chelation therapy, where we remove the excess iron from the body when the child receives repeated transfusions. Then the iron gets starting accumulating in the body, especially in the liver, in the spleen, and in the bones, and this adversely affects the organs, bones, liver, spleen, and for that purpose, we chelate that iron, we remove that iron with the help of the drugs. These are either injectables or these are either the oral drugs. Then the folic acid supplements, we give them. The vitamin B supplements, we give them. And there is the ultimate treatment, that is the bone marrow transplantation for such children. And of course, there's gene therapy, which is experimental. The ultimate therapy is that of bone marrow transplantation, and short of that is the regular blood transfusions, iron chelation therapy, folic acids, and B supplements. What can be the complications if we don't care for the thalassemia? Of course, as I mentioned, iron overload in the body, the heart problems, the heart starts failing, there's liver damage, such children, they become cirrhotic, osteoporosis, infertility, the male child, and of course, they've got low immunity and there is increased risk of infections. Uh, Question comes, can we prevent? Yes. Prevention of thalassemia involves primary prevention, secondary prevention, and tertiary prevention. By primary prevention, I mean that you do the genetic testing for couples with family history of thalassemia or if they are carriers. Then carrier screening is another important point. You do the blood tests to identify the carriers, the prenatal testing. During pregnancy, the diagnosis is made by the prenatal testing, and of course, the pre-implantation genetic diagnosis, testing embryos before implantation. So the different levels of primary preventions are there, and you go as the case requires. The secondary prevention is the blood transfusions. You give regular transfusions for affected individuals to avoid or delay the complications. You give the iron chelation therapy, removing excess iron from blood transfusions, and of course the folic acid supplements supplementing the anemia. So the secondary prevention is the prevention of the complications. And the tertiary prevention is management of complications, like you manage for monitor for the heart failure, the liver failure, and the bone problems. Vaccinations, you prevent different infections, so you regularly vaccinate them against different infections. And of course, you advise the healthy lifestyle, the balanced diet, exercise, and stress management. So depending upon the stage of the disease, you apply the primary, secondary, and tertiary prevention. Primary prevention is that you avoid that the baby, the infant should not be born with thalassemia. And once the infant or the child is diagnosed with thalassemia, then you go for the secondary and tertiary prevention. There's a concept of community-based prevention, and this includes that you create public awareness, you conduct public awareness campaigns. My This Vlog is a part of that. Educational programs for healthcare providers. This is again very important. The threshold for diagnosing thalassemia should be very low, and screening programs for high-risk populations, and of course genetic counseling services. So these are the community-based strategies to prevent thalassemia in any community. Then the pre-marital screening, there should be mandatory screening in some countries, and there are voluntary screening for couples. So these different levels of the pre-marital screening are there. The prenatal diagnosis is very, very important. We do the chronic villus sampling, amniocentesis, and non-invasive prenatal testing. These are done once the pregnancy is there. So in the pregnant ladies, pregnant mothers, you do the prenatal diagnosis of thalassemic patients. How we can prevent these strategies? One is that avoid cousin marriages if there's a history of family history of thalassemia. Family planning and birth spacing is very important, and of course, healthy lifestyle choices. Specific treatment for thalassemia. These depend upon the type of the thalassemia. For example, in alpha thalassemia, you give blood transfusions, but they need occasional blood transfusion, not very regularly. And then you give iron chelation therapy if the child is iron overload, folic acid supplementation, vitamin B supplementations, and genetic counseling. The beta thalassemic children, they need regular blood transfusions every 2 to 4 weeks. They need iron chelation therapy regularly, folic acid supplements, the vitamin B supplements, and these are the patients who may need a bone marrow transplantation and who are benefited by the bone marrow transplantation and genetic therapy but still it is experimental. Then there is another type, that is the thalassemia intermedia. They need occasional blood transfusions, the iron chelation therapy, folic acid supplements, vitamin B supplements, and of course, they may need splenectomy. Then thalassemia major treatment, as I said, regular blood transfusions, iron chelation therapy, folic acids, vitamin B, bone marrow transplantation, and at time they need cardiac and liver monitoring as well. Splenectomy, when we should remove the spleen in such patients, uh, when the blood transfusion requirements are very high, and in splenectomy we remove the spleen surgically, and it reduces the transfusion frequency as well as the risk of infection. This is, you should remember, it is increased in those patients who undergo splenectomy. A few words about the bone marrow transplantation. In bone marrow transplantation, we replace the damaged bone marrow with the normal one. It cures thalassemia major, but the risk is graft rejection, infection, and organ damage. Gene therapy is experimental, as I said before. It aims to correct genetic defect, and the trials are ongoing. And hopefully, in the near future, this will be the therapy of choice for thalassemia patients. Thalassemia may be a challenging condition, but it's largely preventable. With awareness, early screening, and regular blood donations, we can make a huge difference for those who are thalassemia. If you are planning to start a family, get tested for the thalassemia gene. It's a simple step that can prevent a lifetime of challenges. Remember, every unit of blood can save lives. Be a hero, donate blood, and support those in need. Behind every child battling thalassemia is a family fighting for hope. Let's work together to ease their burden through education, action, and compassion. Please share this video with your friends and family to spread awareness. Let's create a healthier, happier future together. Take care. See you in the next video. Goodbye and Khuda Hafiz.